Welcome back to the Overcomfort Podcast. Thank you guys so much for choosing to be here to watch this episode, listening from wherever you guys are at. I greatly appreciate it. As you guys can see from the title of this video, we're going to talk about my surgery journey and have a special guest, my doctor, Dr. Remus Repta. He ultimately has changed my life for the better and has made me feel so confident and safe under his care, under his faculty's care, under everything. Like, I just feel very comfortable and I'm so grateful. So thank you so much for flying out here to be here. I really, really appreciate it.
Thanks for having us.
Of course. I couldn't. Everyone has always asked me questions about you, about my surgeries, about the process. And I felt what better way is to get the man himself to get on the podcast and to answer all the questions and to share, I guess, also a bit of my journey. To start out, I had found Dr. Repta, I think the first one was 2021, the first surgery. My
That
tummy
sounds
tuck.
about right.
Yeah, my tummy tuck BBL. But prior to that, I had lived I've been on a diet my whole life, basically, and it was kind of messing with me mentally until I got more into it and more serious about my mental health and taking care of myself after COVID. And then I had found Dr. Repta. I believe I was just scrolling. I had seen, and I felt very discouraged because a lot of doctors do not allow surgeries due to BMI. And I'm lucky that you do. Which I guess is my first questions because I think everybody has always asked, like, there's no BMI requirement at your office?
Yeah, I don't have a BMI or a weight requirement.
Okay, and the reason is why? Because I feel like some people would probably see it as like a little scary,
Right.
like taking a risk.
Yep.
So can you elaborate on why you don't have BMI?
Yeah,
Weight requirement?
I think that's the ultimate question, and that's the question that we get often. I think sometimes people are afraid to ask because it's like maybe like, hey, why are you doing this when other people aren't? So there's a little philosophical component to it too, right? So I like to look at all knowledge as temporary, right? Because we think we know stuff until we find something else. So the true source of that is back in the 1980s, way back in the 1980s. You have to remember it's like 40 years ago. There was a paper that got published, and all they did is they looked at complication rates for body contouring and then associated with different levels of BMI. And they plotted this data out, and they showed the higher the BMI, the higher the complication rate in terms of like infection and wound healing, things of that nature. And that ended up basically setting the stage for plastic surgery community, the plastic surgeons, putting an arbitrary cutoff at either 30 or 35, right. Even though there's a spectrum. It wasn't like the complication rate all of a sudden was like 0 and then like 100%, right? But that's what I'm talking about in terms of like knowledge is always a little bit temporary. Right. And so I went through that same process. I learned the same information. In fact, when I took tests, that's what I answered. Like, hey, what would you tell someone that came in with a BMI of 35? And that's one of the questions that even like during residency, and the right answer is like, well, tell them to lose some weight. But for me, I had this thought that, hey, yes, the complication rate does go higher up with the higher BMI, but that's if you do the same thing for everyone.
Yeah.
But what if you customize it? What if you change it? Because at the end of the day, we do surgeries on high BMI patients non-electively. Like if you have a heart attack or a mass on your breast, let's say, we would do breast reconstruction all day long on people with BMIs of 35, 40, 45, right. 50, but then we would say no tummy tuck, or no elective cosmetic surgery. So anyways, I started on that journey when I started my practice back in 2008. I said, I think it can be done. And I think it can be done safely and effectively. It just I have to figure out how to do it slowly. So incrementally increase the BMI, incrementally change how I do things before, during, and after surgery. So it's been a 16-year journey to get to where we are now. So in the beginning, I started doing BMIs of 30, 35, maybe 40.
Testing it out.
Testing it out, and then looking how the patients did, changing how I instructed the patients, how I did things before surgery, during surgery, after surgery, looking at the tissues, changing my design, and then it's just slowly increase that, because safety is always the most important, right? Yeah. And so I think last year we did a BMI of 88.
Wow.
Yeah, out of a gal out of New York, she flew in, did a BMI of 88, and even with my staff who's used to doing high BMI patients, even they got a little bit concerned, like maybe we finally pushed it beyond, but we stuck to what we know how to do in terms of educating the patient, designing the tummy tuck, helping them recover, and she healed flawlessly, flew back to New York. Yeah. So anyways, the circle of that answer to your question's a long answer is I do it because I've been slowly developing it over the last 6 years.
Like you've done you have your little recipe.
Yeah.
And you've done every part, which is why I feel so confident in being under and comfortable with you. And I love that you give the opportunity for a lot of plus size women.
Thank you.
Because it's almost physically impossible. They tell us it's impossible. They've told a lot of people. And I love that, you make it possible and make them feel safe and comfortable.
Well, thank you.
And you have a special, the way you handle it is amazing. What is your process before surgery? I've always wondered, because you're very calm, you're very collected. You go in, you're very confident about everything. So is there a process that you do before surgery?
Yeah, and it's changed along the way. I think we all change nonstop in our personal lives and our professional lives, and hopefully we change for the better. We adapt, we try to grow, we try to understand our weaknesses. I've always been a little bit on the OCD side, which is perfect. I got into the right profession for that. I've always been nervous. And even to this day, I have a little bit of that nervous energy about me, but I channel it into double checking, checking, triple checking. So my current process, obviously now it's on 16 plus years of experience, so things come a little bit more naturally, but I still visualize the surgery. And I get into the office super early. I get in there like at 5:15. Patients show up around 6. I don't start marking them until about maybe 6:15. So I have about an hour plus to visualize that surgery, and then we take, of course, preoperative photos beforehand, and they're in the chart. So then I look at the photos and I make little mental notes. This is a little high here. This is a little bit big. This is a little bit, this leads a little, and then I go through my stages. Okay, what do I want to avoid? And so by the time I get into the operating room, a lot of the analytics, the design, the mental gymnastics have been done. So now I can focus a little bit more on that artistry component. But that's my process. My process is visualizing and then looking at the photos prior.
Yeah, you already have it mentally planned, and I get that. I have OCD too, so I get very, if it doesn't go a certain, so how do you prepare for the worst then?
Well, I think it's interesting because obviously you have to zoom way back out. So safety first, right? So obviously you never want to take the things for granted that result in the most health-related things, like obviously things that are associated with the heart and lungs. So, heart attacks and pulmonary embolisms and all that stuff. And although I want to let go of things and delegate, my hands are always in it. So I'm always at the risk of maybe even, stepping on feet. I always double check with my staff. So as we're doing it, even though I've had staff for many, many years, I still double check because we're all humans, right? Yeah. So as I'm doing my part, I touch base with my nurse. Is this on? And they're like, yes, it's on. I've done it like a million times. And then the anesthesiologist, have we given that medication?
Yeah.
And I think as a team, that's what you do. If you're a basketball team or a football team, everyone gets into a huddle. Like, hey, who's doing what? And so we prepare for the worst by over preparing.
Yeah. We're going to go on a quick break, and we'll be right back with Dr. Repta. Welcome back, you guys. Have you had any complications ever? Or
complications always happen. Any surgeon who tells you that they've never had a complication is either lying or they're not operating enough. Okay. Because even during, let's say, a tummy tuck, there's thousands of sutures, hundreds of steps, dozens of medications and little to-dos. We've never had a death, and that's the most important part. Yeah. 99 out of 100 times, the patients fly through the process seamlessly with no complications. And the vast majority of times when we do have complications, there's small complications like suture pops, hair follicle gets ingrown. There's basically things that you just put a little dressing on it, it resolves itself. But I have had a handful of complications along the way where it did require me to go back in and address, like maybe clean things out or send to the hospital for IV antibiotics or things of that nature. I've had a few patients along the way you have to send them to the hospital because they need like extra care that you can't take care of in the surgery center,
Right.
like a blood transfusion or something like that. But we do 8, 9, 10, 12-hour surgeries, 10-liter plus lipos in over 16 years. The chances of someone doing those complicated, long surgeries over 16 years and not having any complications is zero.
Yeah.
Zero.
For sure.
Yeah.
It's something's bound to happen. But
Yeah.
you've handled it well. You know the process.
Yeah.
And again, that is why I'm so confident in being with you in your care. And when I had gotten my tummy tuck and BBL, when I tell you guys, I felt no pain. And maybe that's just me. Everybody's body is different. But even after the second surgery, the lipo and the breast lift, like I've had no complications. I've felt healthy. I felt awake, very, very awake. And maybe that might be a little bit bad because then I feel like I'm okay and I need to,
Right.
I need a rest, but I don't sometimes. And I can honestly say it's how you structure everything. It's how you suture everything. It's, the team, you have an amazing energy.
Thank you.
And amazing office. I love every single person there.
Thank you.
But what made you want to get into this specific practice?
Well, I think the journey starts on, what makes anyone go into medicine in general, right?
Yeah.
And so for me, it's actually a little bit of a funny story. So my parents, I was born in Romania, right? And so we moved to the U.S., actually Los Angeles, we moved initially. And so my parents, being from a poor country, they never actually even went to high school because they're more of like a blue collar work. And so for me, I had no idea of what professions there exist. So I kind of picked a profession out of a hat, so to speak. So like doctor, because you don't really know other than, you don't think of like, oh, I can be an artist or I can be a architect, all that stuff.
Right.
And then when I got to med school, I didn't really like anything other than working with my hands, which is interesting because my, blue collar parents and all that stuff. And so then luckily I ran into my mentor who was a plastic surgeon in med school. And then I love doing that. And he kind of took me under his kind of wing. And then of course you go to residency and so on and so forth. So that's how I got into medicine and plastics. And then when I did my first fellowship was in Charlotte, and I was fortunate enough to work with a gentleman, he's since retired, who was a big body contouring surgeon. Okay. And he had all these ideas and all this work. And then so I was like the young guy coming in. And so together I did all the administrative hard work, and I used, of course, his idea, his experience. So we wrote a book together. It was called Atlas of Abdominoplasty. And then that, of course, set up the stage for me to then do complicated tummy tucks, revisions, repairs, all that stuff. So when I moved to Phoenix, started my practice, I almost instantly just started doing everyone's like revisions, right? So you automatically, all you're doing is revision, tummy tuck, and you're seeing all these complications of other surgeons, and you're starting to learn, right? And then that naturally led me to the higher BMI patients, right? Yeah. So you can see how the dominoes kind of fell. Yep.
You're a very hardworking man.
Oh, thank you.
You have a lot. They tell me he has a surgery this day. What do you do on your time off? Or when do you think it's time to retire? When do you have
that's
an
a
idea?
great question. That's a great question. I've been thinking about it more actually recently. I don't know why. Not that I'm going to retire because I love what I do, but I think, you go over some peak and then you kind of almost like start seeing the horizon and you're like, I better start planning for this because first of all, you're not going to do it forever.
Yeah.
In order to do this type of surgery, your body has to be in good shape. Eventually it wears out and you got to like transition to something else. So I've been thinking about it more, which it's not a midlife crisis, but maybe it's the beginning of a midlife crisis. But I've been thinking about it because, you have to plan for it. So on my time off, my wife and I have a place called Pace in Arizona. It's up in the kind of the woods. And we just go up there. We have a vegetable garden, and pretend like I'm a lumberjack and cut down trees and stuff like that.
Like you're not a surgeon.
Yeah. I'm not a surgeon, but it's interesting because I'm still working with my hands, but now like in like a lower pressure environment. So in a weird way, it kind of works. I used to race cars more often. I should start getting back to that. You start falling off the horse. You're busy. And then so all of a sudden, like a week turns into a month, and a month turns into 6. Then in 6 months, your car doesn't work anymore because it's been sitting there. So a little bit of car racing, a little bit of outdoor work.
You take the time for yourself.
I do. I have to.
Yeah.
I have to come back on Mondays and be not so much physically, although physically you have to be in good shape because if you do 8-10 hour surgeries, we have to be mentally there because you can't cut corners. Once you cut 1, then you cut 2, then you cut 5, then you're mediocre, then it becomes unsafe.
Yes.
Yeah. So you have to be 100% there because again, like we talked about, I have to double check everyone's work. Everyone does a great job in my office, in my surgery center. But I'm the quarterback, and I have to be responsible for the patient. The patient's totally out, and it's my job to be OCD to the detriment of everyone else's, right? So I have to, when you're slightly burnt out or even a little bit lackadaisical, you don't have that mental energy to double check everyone's work.
Yeah.
And I have to be 100% there.
Yeah.
Yep.
And I think that's important, especially I think in your field, like you have have to be on call, I'm assuming, and just making sure, taking that time for yourself. And I think in any line of work, I think it's super important to make sure you have that time to yourself because like you said, you are in the operating room 8 to 9, 10 hours, and you said you only do surgery once a day? A day?
We do about 8 to 10 hours of surgery per day, about 3 days per week.
Okay. Yeah.
And then obviously sometimes it fluctuates a little bit. If I do a 10 to 12 hour surgery, I really feel it the next day. Yeah. And like 10 years ago, maybe I would have sprung back. So now I'm starting to book those longer surgeries going to like the weekend, because I need that recuperation time. Yeah. Mm-hmm.
Is there a favorite surgery you like to perform?
Well, it's interesting. I think we all want to be good at something. And then when you're good at something, you like it. And when you like it, you're good at, so it's like this circular process. So I feel supremely confident in tummy tucks. Not that there's no room for improvement, not that there's no room for learning, but I just feel so confident. And so I love doing those. Plus, with the higher BMI patients, with the patient clientele that we have now, the results are so dramatic and they're just so fun. They're just so fun seeing the patient, even like, they stay in our overnight facility and the next day I take a quick peek at them and they look in the mirror and like instant emotion on their part. That kind of gets me a little bit emotional, all stuff. And so it's nice to see that dramatic change. Technically, rhinoplasties are super fun because you can be OCD and you're rewarded for it because a millimeter makes a difference. A millimeter in a tummy tuck, nobody's gonna notice it, right? But in the rhinoplasties, you can futz around with a millimeter and it's totally appropriate.
Yeah. I want to talk about the bra line back lift because you specialize in that, right? Which is basically, I like to call it the tummy tuck for the back.
That's a good way to do it.
The tummy tuck for the back. How did you discover that and what? Because I feel like you're a master at that as well.
Thank you.
Which is what I have gotten as well. I have the tummy tuck, BBL, the bra line back lift, all in one surgery. And then we did the lipo and breast lift.
Yep.
Yeah. But that was the part of my first ones. And I want to know more about that. It's worked wonders for me. Sometimes the skin back here and I learn a lot of new things from you as well, but sometimes it's not going to go away.
Right.
And that's the best way to do it. But yes, tell me about that.
Yeah. So the bra line back lift got published in 2008. And it was actually my mentor. His name is Joe Hunstead. He's since retired. Is the gentleman I spoke with. I did my first fellowship. He had experimented and kind of come up with that procedure. And then so when I did his fellowship, in fact, I was like his first main fellow. He had all these ideas and knowledge, but it never got out there. He was like basically, because he's just so busy. And so he and I published the bra line back lift, and then I think it's a great procedure. I think it's exactly like you said. It's like a tummy tuck for the back, and it's such a good way to think about it because if you have loose skin in the front, you have no problems doing a tummy tuck. Women get it all the time, and I think in the back, for a long time, people are like, well, there's loose skin in the back. There's nothing to do, But that's like one half of the equation because the waist needs to be smooth and contoured all the way around, right? And so then over the last 16 years, I just refined it. And if you do it really well and you do some extra lipo back there, and just like the tummy, if you do a good tummy and you do the lipo through the flanks, then the waist gets it doesn't get longer, it gets narrower, but it looks longer.
Yeah.
Right?
The illusion, the torso.
Yeah. And then the hips flow into the waist, and then everything. I think it's such a keystone procedure. So oftentimes when patients do the consultation and I have my breast bothering me, my arms bothering me, my back bothering me, my tummy. And of course, you can't do it on one stage. I say, well, if it was me, I'd start with a bra line back lift and a tummy tuck plus or minus breast. And that just works so well. So that's how it started, and I refined it over the process of the way. I especially like how the side of the chest gets contoured.
Yes.
And I found that it actually helps me support the breast lift more, right? So my breast lifts, because if when you gain weight, you lose weight, and maybe gravity pulls the breast down, your breast fold, which originally was horizontal, the bottom of it, the outside portion of the breast fold gets canted down because all that tissue slides down. And so when you do a breast lift by itself, then the tissue gets lifted up, but that fold still is like down and out. So when you do a bra line back lift, you lift it back up. So I think it actually helps the breast lift.
It does. It does. And I'm so happy with my results and everything that I've gotten. I have no complaints at all. I know there's girls or people, because you work on men also. We're going to go on a quick break, and we'll be right back with Dr. Repta. Welcome back, you guys. How do you handle when the results isn't exactly how you envisioned it or how they come out?
Right. Yeah. So I think it's important for plastic surgeons to be their own worst critic so that the patient can be happy, but the plastic surgeon almost has to be unhappy, not to the detrimental where it's like bad for your mental health.
Right.
But so I take photos, and this is how we started posting on Instagram and things of that nature, because I always took photos before and after surgery so I can compare right off the bat, right? Because I had an idea of how I wanted surgery to go, and then I wanted to compare. Because they give instant feedback, right? It's like cooking, and you're like tasting, like, oh, okay, too much salt, whatever that is. And so I'm the most critical because I want to obviously improve, do better. Now, when there's unhappiness on the part of the patient, I'm an open book. So I'm like, okay, well, let's totally discuss it. What are you unhappy about? Are there some things that we can improve on? Are there some things that I could have done better?
Right.
And then I like bringing in photos, because sometimes the patient might be unhappy or unsatisfied, but then when you look at the photos and you do some measurements, they forget what they look like, and then all of a sudden there's still opportunity maybe for improvement, but now maybe their mind has caught up with the reality. And sometimes we look at before and after photos like, totally, let's take a little bit more lipo, let's take a little bit more skin. I could have done more, or maybe your skin stretched out. I am there for my patient's kind of journey. I'm there to complete that process and do the best that I can for them. Sometimes it's important for them to look at the before and after photos, because there's that transition before, like how they envision themselves and how they really are now.
Is there anything that you haven't done that you would like to practice or like to do one day? A surgery?
Yeah, I think I just want to do everything better. I do facelifts, I do rhinoplasties. I don't do a ton because obviously I do so much body contouring. So I do a lot of tummy tucks and bra line back lifts and breast lifts and arm lifts and thigh lifts. So I think the key is just to get better and better. I'm an interesting point in my practice, because if I do something new, I have to ask myself, well, is there someone else out there that can do it better than I can? Because if they can, I should refer them to them, right? Because I want to just be in this arena of excellence.
Be honest.
Yeah, totally honest. You just send people to the people that have more experience in that. I'm in an area where I just tend to get very challenging surgeries, even like mesh removal from prior hernias and weird complicated hernia replays. And so sometimes when I do surgeries that I've never done before, but also they've never been done before, right? And then so I sit there with it and I tell the patient, like, listen, I've never done this before. It doesn't technically exist. I know how to do components of it. I think I could pull it all together and do it for you. And it's kind of scary and it's kind of exciting,
Yeah.
but the patient's kind of scared, but also relieved because there's no other answer.
Yeah.
So one of the things that I've started doing over the last maybe 5 years or so is something called congenital somastia.
Okay.
It's when patients are born with no cleavage. It's like one breast
Okay.
all the way across. And so that doesn't exist. I've done maybe 2-3 dozen of them, and I'm getting ready to publish that as well because we gotta get the information out there. Yeah.
Yeah, because then people think that it's not possible,
Yeah.
and there's a lot of people in this world. I do want to say, like, I think one of my favorite things about getting surgery done by you is that you've obviously made me feel confident. But before, when we've been on the phone, when at my pre-op appointments, you've also, like, you do not pinpoint anything that I need to get done. It's always what I want and what I feel. And obviously, you give your honest and humble opinion in the most sweetest and kindest way.
Oh, thank
So
you.
I love the way you approach your patients and the work that you do. Have you ever said no to a patient, though?
I have, but it's not very common. I thought when I was training that it would be a more common thing because I would find interesting things about how patients thought or their visions of themselves or like, that body dysmorphic disorder. But I think you kind of, you attract who you are and, it's a kind of self-fulfilling prophecy. So most of my patients are great patients and they have reasonable desires and reasonable expectations. So I rarely come across situations where I either don't feel like I'm the right surgeon for them or they're not the right person to have that surgery in the right mind frame or body. Every once in a while I might pause them.
Right.
They might want certain surgeries and there's just enough details of their medical history. I'm like, let's circle back on this. I have a little bit of I have a gut feeling about this. So if you're okay with it, come back in another 3 months and then let's reassess, that kind of stuff. But I think you kind of attract, we all have family and friends and things of that nature. And, you kind of attract the same kind of tribe. And most of my patients are just good, happy patients that have gone through journeys of weight gain, weight loss, and, trauma of one way or the other. And they're totally great patients and they're happy. And I rarely have confrontations with patients. Obviously, every once in a while you might have a patient that, maybe not in the right frame of mind and I don't catch that and things of that nature. But by and large, we've been really fortunate. I'm grateful for it. But yeah, no, it's surprisingly not a lot of no's out there. Yeah.
Okay, so who gets a yes? Like, what are the requirements?
Well, so it's simple. And I think it's important to not get lost in the weeds. Like, remember we talked about the BMI paper, and like, oh, BMI 35, no for everyone. Well, okay, why is that? Can you do it differently? And what does all that mean? So for me, I have two basic check marks for a green light to have surgery is the main ones is one is, can I do a surgery on this person and do so safely, right? Because safety is always the most important. Second is, if I do the surgery and I can do so safely, will they get a great result? Great result meaning, will they be happy?
Yeah.
Is that a good investment of their time and money, right? Because as soon as I check off those two boxes, it's a green light for me. Because why not? If they're going to be happy and they're happy with the time and money they spent and I can do so safely, like that's a win-win for everyone, right?
For sure.
Yeah. Then of course you get into the details of like, are they getting pressured by this? Sometimes you can feel people stretch, like, maybe they have circumstances in their family and you can just feel like they're stretching. And then sometimes they just bring it up like, is this a good time for you?
Yeah.
Because I'm not going anywhere. It'll be, if it's a better time for you 6 months from now or a year from now, I'll still be here. And it's interesting because, sometimes patients take a year, 2, 3 to find me, think about it, and then make a decision. Because it's a big financial investment and they have to set up their time.
Consultation.
Yeah, totally. That's why I think consultation is so important. And it's funny because then they have surgery and then they're like, man, I wish I would have done this 3 years ago. I'm like, but I'm much better now than 3 years ago. So isn't that great that you wait, So,
Exactly.
It's kind of that's the benefit of always getting better. Just the process of bettering yourself.
For sure. Well, I want to thank you again so much for coming here and giving us your insight and your thoughts.
Thank you.
One last question. What is your piece of advice for anyone entering the medical field or specifically the practice of plastics?
Well, there's probably a lot of downward pressure on going to medicine now, meaning like parents that are doctors are not recommending medicine to their kids because there's been a lot of changes, and maybe the changes will start going in a different direction, but the autonomy of doctors have kind of decreased, and maybe the some of the benefits of going into medicine has changed. So I would just say, you know what, give some thought to the end result. Where do you see yourself like 10, 15 years from now? Because things change. You might want to go into medicine for one reason, but you have to remember that you're going to change. 5, 10, 15 years ago, you may want to have a family. You might want to have different flexibilities in your life. So give that some thought. The benefit is that you can go into medicine and then you can just change. Yes, there's an investment of time and money, and you know, don't look at it as like wasted opportunity, because that's all knowledge and you can parlay it into different things. Maybe you come up with a technology or a product and you're going to be a better inventor if you're a doctor, if you go into that kind of stuff. So I think it's, you know, you don't want to have regret. So if you want to go into medicine, try to define what that really means for you, whether it's, you know, working with your mind or working with your hands. Try not to go into it for money, because, you know, the money should be a byproduct of doing something that you're passionate about. It always comes with it. And then try to think about like lifestyle, you know, like, you know, do you want to be in the hospital? Do you want to be in the operating room? That kind of stuff. But just in generally be honest with yourself. If you want to do it, do it. And if you change your mind later on, that's fine. People change careers all the time. We change as people, right? And then just change tracks. I think I'm not a big fan of poo-pooing things like, oh, things aren't as good as they used to be. Well, things always change, right? So if you still want to do it, make it better. Yeah.
Yeah, that's good.
Yeah.
I love that. I love the way you see life and see
thank you.
everything forward, and it's very positive, and I really appreciate it. It brings like a good energy, and I think importantly as a patient as well. You know, I think the first time that I met you, I was like, oh yeah, I'm gonna be good. Like I'm in good hands. I don't have nothing to worry about, and people, okay, so you guys can go ahead and reach Dr. Repta for a consultation. Everyone's prices are different. My price might be different from your price, but I definitely recommend you guys checking out, getting a consultation if it is something that interests you. I put my life in this man's hands twice already, and I've came out great. And it's worked out amazingly, and I'm very happy with my results. And I appreciate you so much. Your art and your technique is very, very appreciated. And
Thank you.
It is a one of a kind. And, you know, if you retire, that's fine. I have no other surgeries that I want to get, so that's fine. No, but I really, really appreciate it. And especially coming from someone that is plus size, like I really appreciate you breaking the norms and looking into it and, you know, testing things out and taking that risk. So I applaud you, because I'm sure it's very scary and weird.
Thank you.
Yeah. But yeah, thank you again. Make sure you guys follow Dr. Repta _
plastic surgery. Yeah.
Okay. If you guys are looking into getting surgery, want to know more about Dr. Repta, please follow him on Dr. Repta _ plastic surgery. He is available. He has a great team. Get a consult if you really want to. And yeah, so thank you again.
Thank you. It's been fun.
And I will see you guys next Tuesday. Bye.
Overcomfort Podcast is a production of iHeart's My Cultura podcast network.